A good Cathaoirleach. Minister, I welcome the opportunity to speak on this very important matter here tonight, and obviously it's very upsetting for so many parents across this state and for even TDs here as well who have had personal experience in some cases or in some form. At the outset, I want to note that we should always at least try and avoid the temptation to make any single institution the scapegoat for what are clearly systematic problems around governance and the care of children in the Irish Health Service. And I do want to note that we do have fantastic people working in the health service, but where there are issues and where mistakes are made, we need responsibility and we need accountability, and we need the problems to be resolved, and we need to make sure that they never occur again. And I think that's something that we all need to be committed to. Unfortunately, children are on the receiving end of appalling service deficits and have been long before the CHI scandal arrived on the scene. And that being said, it is impossible to stand here, having reviewed the record of CHI since 2019 when it was established, and be anything other than appalled at the sheer horror that has characterised its grievous failures. I look back now at the debate in September 2018 when the Children's Health Bill was introduced by former Minister for Health Simon Harris. This bill provides CHI with its statutory remit, and at the time Minister Harris stated that CHI had been given broadly worded functions that would, and I quote, provide clarity, authority and certainty relating to its leadership role nationally in paediatric healthcare and the national model of care. It will deliver on its remit for education, research, philanthropy and advocacy on behalf of children's healthcare in this country, end quote. Minister Harris also stated that the new entity would be led by a 12-member competency-based board appointed by the Minister for Health. And this makes it absolutely clear that there is an element of political and ministerial accountability here that cannot be evaded. The ministers that have been and gone appointed the leadership of CHI, and yet time and time again it has displayed catastrophic failures of judgment, of which the National Children's Hospital is the most recent and most blatant. We can sit here and rightly condemn CHI for its institutional failures, but we must also insist on political accountability, or this cycle of vicious incompetence will never end. And I have actually met the parent of a child who has fought for so long to get an operation for her child, and what she has said to me is that, as well as the frustration and the upset, there is a serious vacuum when it comes to communication, and that certainly is something that should be easily fixed. We need communication with parents whose children are caught up in this, or parents of children who are still waiting for important and big operations. Carol Nolan.